Dr. Redlener, thank you so much for coming on. And I think it might surprise folks that a doctor from New York would have had so much experience in rural America. And so I want if you could just spend a few minutes talking about your experience and how you started and your interest in delivering higher quality rural health care to children in my part of the world.
Sure. So actually, my first job as a physician after my training, I was supposed to be heading to a career in pediatric cardiology, and I saw a poster that said it was an old Vista Volunteers in Service to America poster on the wall of the doctor's dining room on the bulletin board, and said, if you're not part of the solution, you're part of the problem. And it talked about the dire circumstances in the Mississippi Delta of state of Arkansas. And I went out that weekend to visit, and I was just overwhelmed with interest in going there. And we ended up spending 2 years in Arkansas. I was the director of a federally funded clinic that ended up becoming one of the main sources of health care for the entire region in rural Arkansas. And then later, we started an organization called Children's Health Fund, the we being my wife and the singer Paul Simon. And that started in 1987. And we've been providing very comprehensive health care to children in many rural areas around the United States, including in Texas, in southern Arizona, in rural Mississippi, and so on. So I think there are some commonalities in terms of the challenges for children for poor children in urban areas and in rural areas, and a lot of it boils down to not having access to appropriate, high quality medical care, and so I'm pretty sensitive to what's going on in America's rural communities, even though I'm from Brooklyn, New York originally, but I've spent an awful lot of time thinking about and working with children and their families in these very isolated areas where access to medical care is just extremely difficult.
And on top of that credential, you also have become a national expert on pandemics. Can you explain how that transition happened in your life?
Well, so at one point in my life, I was the director of a very large pediatric intensive care unit. This is after my experience in Arkansas. I went back to where I had gone to medical school, which was in Miami, Florida. And the first thing that happened that was extremely influential in my career was that I organized a couple of medical teams, and we went in 1976 to help out after a massive earthquake in Guatemala. And that sort of set me on a path of, thinking about disasters and what can be done and what needs to happen. And then I established something called the National Center for Disaster Preparedness at Columbia University, and that was set up in 2003. So since 2003, we've done a tremendous amount of work on disasters of all types, including planning for pandemics. And by the way, even before the center was formally set up, it was still something I've been thinking about for quite some time. But once the center was set up, we've been involved in many, many disasters, including, major hurricanes, Hurricane Andrew in South Florida, which is a true Category 5 hurricane in 1992. The hurricanes of, the Superstorm Sandy that hit the New York area, Hurricane Harvey in Texas, Hurricane Michael in the Florida Panhandle, and so on. So we've been really quite involved. But the pandemic situation, which sort of leads us to today, is something that I've been involved in since around 2006 or 7. The federal government at that point was doing a lot of pandemic planning. We were worried about an avian flu type of pandemic, and we needed to be worried about it. And every state, besides the federal government, every state and every city really had a pandemic plan that was on the shelf.
Well, and I think one of the questions that people have, especially in rural America, is, look, seems to be an urban problem. It's hit New York City quite hard, New Orleans, all of the urban areas. A listener who feels a lot of complacency about whether this could, in fact, affect rural health care, this pandemic that we're in.
Well, it does. There's a couple of issues about this, Senator. One is that a lot of rural Americans, a lot of Americans who live in rural communities, live in areas that the federal government calls health professional shortage areas, where well before the pandemic and for decades, there are not sufficient doctors in a lot of our rural communities around the United States. And the designation of the federal government of health professional shortage areas, or what we call HPSAs, includes about 65 million Americans who live in areas that already have a short supply of doctors and health clinics and so on. So the difficulty getting access to medical care is a very long-standing one. And then if we get something like an outbreak, and by the way, we're getting cases all over the country and in many rural areas. So far, they're not resulting in massive outbreaks like we've seen in New York or in New Orleans, but I don't think people should feel complacent about that. And I do think I'm concerned. There's been some serious reports of COVID-19 in the Navajo Nation, for example. And I think I've been in touch with people in Mississippi, in Arizona, and so on, and they're all seeing cases that people I've seen and worried.
Yeah, I'm deeply worried about what case of our Native American reservations, and certainly given it, and not that every culture doesn't respect their elders, but this is a culture that not only respects their elders, but expects that their elders will live with them. And so an outbreak will have a dramatic effect on some of the most vulnerable. And so we're seeing the higher rates of minority deaths, higher rates of deaths from the COVID-19 based on chronic conditions, which we know track poverty.
Absolutely. And this is why complacency is not the right approach right now. I think we need to be extremely attentive to how things develop among Native American populations, but also in all populations in areas where there's poor access to medical care, and also poor access, by the way, to PPE and other things that people need.
If I could ask you a couple tough questions. First off, if we had people who were living in rural areas, were healthcare providers, what advice would you give to them right now on the pandemic, and what would you encourage them to be doing to prepare for any kind of future respiratory pandemic?
Well, first of all, the hospitals in rural areas have to really be thinking about how they're going to handle a potential overwhelming number of people that will get sick in their communities. Are those hospitals prepared? And people in those communities, if I were living down there right now, I would have, masks, and I would have gloves there. I would be very attentive to preventing the spread of disease, whether the state requires it or not. I would really try to maintain, physical distancing or social distancing, as some people call it. And I think I would start thinking about what I would do if there was a serious outbreak in my community, so you're not caught unprepared if there is somehow a real significant outbreak of COVID in your community. So being prepared personally, making sure local hospitals are prepared, and people take it seriously would be the things that I would recommend. And by the way,
go ahead.
One of the things, like I mentioned, so I think we have to think about illnesses differently. So if somebody, you or somebody else or somebody you're close to, is develops symptoms that are flu-like, it's very important that you get tested, because the so-called regular flu is very likely to be COVID-19 right now. And the other thing to be aware of is that there are certain groups of people who are extremely vulnerable to getting very sick, which would include older people and people with pre-existing conditions. And the most vulnerable, of course, being an older person who has, diabetes or obesity or hypertension or lung disease. All those people would be particularly vulnerable, so they should be really, really careful not to be around people with any kind of symptoms, and to make sure that they are in a circumstance where if they had to shelter in place for a while, they'd be able to do that.
And once again, it goes back to the ability to test. For many of our rural communities, one of the largest employers in many mid-sized rural towns is the local nursing home. And right. Obviously very concerned about any kind of outbreak that would happen. You look around, I go to the grocery store, I wear my Minnesota Twins mask, which gets a laugh from almost everyone. But maybe 10-15% of people in the grocery store are actually wearing a mask, and very few of the employees are wearing a mask.
Yeah, well, you just contrasted what's happening in New York. Not only are employees and customers wearing masks, they're also limiting number of people in the grocery store. So there's lines outside the grocery store with people separating by, at least 6 feet. And then they're not allowed in. One person comes out, another person goes in. And those are the kind of things that are potentially coming to rural communities.
Yeah, I think it's and I hate to draw this parallel, but for years, rural America thought they were exempt from any kind of addiction epidemic. Guess what? They're not.
No more. Exactly.
Right.
Exactly.
And I like reminding people when they say, oh, this isn't going to happen in rural communities. I said, you never thought you'd have an opioid addiction problem in rural communities either. And so, you're not immune from this disease, a tragedy for so many families, and certainly for your home state, given the number of deaths in New York. Also is an opportunity for us to talk about healthcare, because we know that chronic make people more vulnerable. We know that many chronic conditions are preventable with the right kind of treatment and early interventions, and let's admit it, with changes in human lifestyle. What do you think? What do you think we should take away from this in terms of creating a more resilient healthcare system to something like this, but also population?
Right. So there's a couple of things about this. I think healthcare in America is going to never be the same again. I think it's pretty clear that we cannot have anybody that's uninsured. I'm one of the people in favor of, continuing with the Affordable Care Act that President Obama put in place, but supplementing with a public option so that everybody can get into the system. Secondly, I think especially in rural areas, we need a lot more federally qualified health centers. So we need a lot more clinics that are based on a sliding scale fee, that are supported by the federal government, and that are everywhere. We cannot have so many Americans living in communities that have real difficulties getting access to medical care. So big investments in the community health center movement would be really great. Second of all, this is true in New York, and I imagine it's true in rural areas. I know it's true in many rural areas where access to medical care is different, is reduced, that we have people that use the emergency rooms of hospitals as their primary care doctors. And that can't happen anymore. We have to, we have to free up the emergency rooms for actual emergencies, and we have to make sure there's enough of these federally qualified health clinics everywhere, so that nobody needs to go to the hospital unless they're actually really sick and they need acute evaluation and they may need to be hospitalized. Senator, what kind of doctor is your husband? I'm just curious.
He's a family physician. works in a small clinic with 5 other practitioners, and it started out where and this is the transition that we're seeing right now with the pandemic. Very few patients. Now he's back to his regular load, and the precautions that they're taking. Again, as nationally people say we have enough PPE, he's expected to wear the same mask every day for a week. And the healthcare facility that he works for.
It's a different world, but I do think we're going to see some changes. Like I said, we starting with we can't tolerate people without not having insurance and not having a quality place to go to. So
the great thing about community health centers, and I'm a huge advocate, as you see, the people who aren't familiar with this type of practice, in most community clinics, they will have dental care, which often gets forgotten.
I mean, there's a lot. This is such a surreal time, Senator. We're dealing with something that's changing our lives, and it's going to be a long time before we see, some sort of return to full-scale normalcy, and the normalcy is going to be different. I keep telling people there's a light at the end of the tunnel, but it's a very long tunnel, because I think this pandemic is going to be with us for a while. I think it's inevitable, essentially, that we'll see a second wave in the fall and the winter. We don't have a vaccine yet, and so on. So right now, the entire country, everybody is having to cope with this reality that's been caused by the pandemic. And by the way, I really also want to say that I've been extremely disappointed and amazed at the incompetence of the federal government here. What's come out of the White House has been astoundingly inadequate. A lack of intelligent leadership, a lack of direction for the whole country. Whatever the president's messages are that get instantly contradicted even by his own advisors. All of this really does undermine confidence in government, and the incompetencies have been pretty stunning as far as I'm concerned.
Instead of hunkering down and saying, how do you get PPE, and then transitioning to how do we make sure that we have the manufacturing capacity in future events to turn on a dime to manufacture these kinds of products. I mean, I'm not sure you want to stockpile for years a lot of PPE, but you need to have the capacity to generate it very quickly and generate it with reliance on foreign manufacturing. I mean, there's just such an interesting point of view. I have a friend who wrote a book once about, take this job and ship it, and bemoaned the fact that we don't make Huffy bikes in the United States anymore. I said, I'm not worried about a Huffy bike. That's not an essential piece of equipment. But certainly, if we don't come out of this pandemic and evaluate where we get our antibiotics, where we get our precursors for testing, where we get PPE, and what capability we have to have in this country to manufacture and generate those levels of supplies very, very quickly in the event of a pandemic, then that's rule number 1 in my book. And there's a lot of folks now producing ventilators. That's good, but it ignores the fact that my husband is still wearing the same mask every day for a week. And if I'm one of his patients, I don't want him to be wearing the same mask every day for a week.
No,
right?
You don't. It's exactly right. And I had the same experience with my son, who was in pain, having to tell all the staff that they can't change between patients, and they're sick patients, obviously in the emergency room in New York. And it's really forced us to take a real look at our systems, what we're prepared for, why we were so unprepared. Well, it's terrible.
Doctor, all of the great planning and the great work that people like you have done, and let's acknowledge George W. Bush, who put pandemics on the front burner, and President Obama, who, there's been a lot of criticism of President Obama from the current administration. But I remember interviews when they said, "What kept you up at night as a president?" And he said, "A respiratory pandemic." And there were a lot of plans done and a lot of ignoring of those plans. And I think it is time for everybody to get in a room, Congress and the White House and the Health and Human Services and the Department of Homeland Security, and sit down and make a list. What have we learned so far? And let's not forget this, because we're now going to get lost in whether we should be helping state governments, whether we should be giving liability assurances, and I can see the gravitation all the way back to everybody's kind of zone of political rhetoric, as opposed to responding to the public's concern about preparedness.
Yeah, this should be completely apolitical. This is about the resiliency and survival of Americans of all parties, of all stripes, and that's the way we should look at it. But my concern, too, is that after every major disaster, there's always kind of a hot wash or a after-action report. There are always described lessons learned. The problem is we may learn the lessons and we'll write them down, but the question is, will we apply those lessons? And that's where, we're going to have strong political leadership from both parties that say, look, here's what we learned from this pandemic experience, and here's what we can never allow to happen again, and come up with plans that, and like you were talking about, the manufacturing of certain things, we can't be dependent on, we have the testing equipment. We don't have the nasal swabs to get the samples. We don't have the chemical reagents necessary to test for the virus. That cannot be. We have the capacity to do that, to manufacture those kinds of things here, and we should make sure that we are doing that, and that we can turn on a dime, like you said, to make things happen. We have the Defense Production Act.
One of my great hopes is that you will participate, and people like you who not only have the experience of working in major medical centers in urban areas, but also, have a understanding and a passion for delivery of rural health care.
I think that people in power, except for people representing rural states like North Dakota and everywhere else, there's a general kind of sense that they're secondary parts of America, and they're actually primary parts of America, and they need to be understood as needing the kinds of services and resources that everybody else gets. And I think we sometimes forget that. And I think this issue about building community health centers is a good example of it. The entire country needs to make sure that every American has access to quality health care, and the federal government has a major role in making that happen with the development of these more and more of these community health centers. We probably need twice as many as we currently have.
I think as we move forward with healthcare, we need more advice from healthcare professionals like you, and less advice from politicians who want to politicize healthcare. And so, people really see firsthand the sacrifice people who work in rural healthcare are making, but also the fact that it is absolutely one of the most essential services we receive in this country, and it shouldn't be based on your income level.
No, one other point I want to make about this is every medical school in America gets a lot of federal support to operate, to train, to teach doctors, et cetera. And I think there should be some sort of payback, that every doctor and every nurse has to spend a couple of years in an medically underserved community, just as part of our national collective commitment to the public good that involves the entire country. And if it was up to me, doctors get to choose the, whatever communities they want to work in, and, they can go to the more affluent ones, whatever. And I don't, that's fine, and that could happen. But I think they first ought to give back to the country with a couple of years of service in an underserved community. and working in what I hope will be a whole new wave, a whole new development of community health centers around the country.
Well, amen to that. Thank you so much for doing. I hope someday I might be able to meet you in person. And we're trying to put together policies for Democratic candidates to run on, focused on putting together rural healthcare policies. And so it would be great to run some of our ideas past you.
Anytime. Seriously, you should have my cell phone and my email, and just don't hesitate to reach out anytime.
Well, and I love the expansion of the public health commitment. And certainly you seem very aware of the healthcare disparities in Indian reservations, which is an abomination what Indian Health has done.
Just absolutely horrible. And if there's anything at all I could do on that front, I hope you'll call on me. But it's horrifying how much we've left out people from just the quality of life issues, and specifically access to the health care they need. The health care has been, I'm trying to use the right language here because I know this is kind of a family podcast, but we have a lot to make up for. All I can tell you is that they deserve a lot of attention. So.
And one of the great movements that I've been part of on reservations is the nutrition movement. Again, going back to creating more resiliency, but the chronic conditions, the diabetes, if this thing catches hold, if it catches hold in Indian communities, I know that a much higher percentage of people will die as a result of contacting COVID-19.
No question about it. So I'm really happy to speak to you now or anytime going forward. So please do reach out.
Terrific.
Thanks for listening. And if you're really interested and you want more information and want to actually see visually what we're talking about, join us on social media at onecountryproject.org.